Hello, everybody. I'm Patti Patane. Intelligent conversation. I suggest that you pay very, very close attention to this program today. The reason being that if you're 40 years old, kind of, sort of, if you're 55 or 60 years old, kind of, sort of, you're going to need the information that we're going to be talking about today because it involves healthcare to a degree and general care, and we also are going to talk about the upcoming, what is being referred to kind of as a train wreck, the Obama healthcare. How are you going to navigate all this stuff? Well, I have someone that will do that with you. His name is Bill Robinson. Hi, Bill.
Hello there, Patti.
Bill is the owner of Palm Canyon Insurance in Palm Springs, California. Now, there's a couple of things. You're probably thinking, well, I don't have to worry about Medicare or any of this stuff because I'm only 40 years old. Well, how are you going to pay for it when you get to be 65? Or, well, I'm not going to think about that right now because I don't want to be bothered. Yeah, welcome to the real world, ladies and gentlemen. You do want to be bothered, trust me. There's another thing you have to be bothered about. We're going to talk about two things. We're going to talk about the Medicare and the supplement, and trust me, even if you're 40, you need to pay attention to this. And we're going to talk about long-term care insurance. And you're thinking, what do I need that for? Well, do you want your kids changing your diapers if something happens to you? Do you want your partner, your loved one, your best friend, your husband, your wife changing your diapers? I don't think so. I went through that with my mom, and I did not want to become my mother's mother. I wanted my mom to be my mom. Well, there wasn't anything really at that time called long-term care insurance. I mean, she had the Medicare and all that other stuff, but it's not enough because it doesn't pay like it should or could. You think it does. It's just not going to happen. I have chosen Bill Robinson as the go-to expert, knowing person that I will call for all of my questions about long-term care insurance, Medicare supplements, all this stuff, and he's the person that I want you to call. Now, is he going to try and sell you something? No. If you want or need something in the field of Medicare or long-term care insurance, will he sell it to you? You bet. You can trust him. He has a long history of this. And he loves to teach people what is needed in this complex world of Medicare insurance, long-term care insurance, particularly when you think you don't need it. How big a problem is it, Bill, that somebody who's 40 years old says, I'll think about that later?
Well, if they're a millionaire, it's not a problem, but most of us are not, and the dollars involved to take care of your health care needs after age 65, and should you need any kind of long-term care, which isn't just a nursing home, which is the last place any of us would want to be, but home health care where you can stay at home and know your surroundings, but you need help, custodial and maybe medical, or at least an assisted living facility. They all cost a lot of money. Most people haven't saved enough to retire comfortably, so where are they going to get the money to pay for these other services?
But the people that I question about in doing research for the program, they will say, well, I can get Medicare insurance and that'll take care of me if something happens.
Medicare pays almost nothing for any nursing long-term care coverages. Medi-Cal will pay nursing home coverage.
Trust me, you do not want state care. You don't want it. It's a last resort. It is not, let me put it bluntly, Medi-Cal is not very good. It's to be used only if it is absolutely the last thing that you can possibly get.
Because it's underfunded, and the only facilities that take such patients leave a lot to be desired.
Very much.
So you need to plan at an earlier age how you're going to cover those expenses, because if you do, you will spend a lot less money than you will if you wait till you're 60 or 65, which is unfortunately what many people are still doing.
Okay, let's talk first and foremost. We're going to spend probably the first bit of the program on Medicare supplements. Then I want to talk to the people who are 40-ish, 40, 45, 55, about long-term care insurance. Two things, two very important things. Don't just sit there and say, oh, come on, Patty, I'll think about that later. Look, I'm only 45. I don't need to deal with this right now. Trust me, yes, you do. Okay, Bill, here we go. Let's talk about this Medicare thing. Now, I'm going to try and play back to you what I have learned as a result of asking you the questions that I wanted to know.
Okay.
Here's what you have taught me. Let's see how well I've learned, okay? Let's just stick with the easy part. Yes, you can take Social Security at 62, but that ain't got anything to do with Medicare insurance. You can't get a dime of Medicare insurance until you are 65 years old.
That's right.
Okay? 65. Now, when you do get Medicare, they will take about, and I'm kind of guessing here, about $100 a month out of your Social Security check to pay for your basic Medicare.
$105 right now this year, 2013.
Okay, so it's about $100, and it'll go up.
Yes,
No
a little
doubt.
bit every year.
A little bit every year, but nothing that's not affordable. Okay. Now, that will take care of, well, yeah, it'll sort of take care of you. It will allow you with no additional money. We're not getting something like a managed care, like what you call, what is it?
Medicare Advantage HMO plan.
HMO plans that come in the name of what? Aetna or what are they names?
Well, they're different marketing names: Secure Horizons, Senior Advantage, Senior Secure, but they're all Medicare Advantage HMO plans, which take care of all of your care, small co-payments. Right now, no premiums.
Yeah, you can pay zero.
But you're very restricted.
Right. Can I suggest that you really try to plan ahead so that you don't get just the zero premium Medicare supplement? Don't do that, because it's not very good. The reason it's not very good is because you are at the mercy, at the absolute mercy of the Medicare system of managed care. You get into something called managed care. I've got one here. Let me tell you something. You know what you get when you want something a lot of the time? You have to, let's say you want to go to a physical therapist because you kind of hurt your shoulder or something, and you went to the doctor and said, yeah, you need a physical therapist, and you happen to know that there's a really good physical therapist, and you want to go to that one. And they'll tell you, no, you can't go to that one, you have to go to the one that we want you to go to. No, I want to go to mine. Guess what you get? A notice of denial of Medicare coverage.
Yeah, you have to stay in the network, and you have to get permission.
Bet you.
You also need permission to see even the specialists in their network.
Right. You have zero choice, you have zero freedom when you are in a managed HMO, zero premium Medicare supplement
And just to
thing.
be fair, folks, there are many seniors who, when they get to that point in their lives, they have limited income. They cannot afford to pay any premiums for anything. They have Medicare, which doesn't pay all of the bills. Then a Medicare Advantage HMO, which will pay all the rest of the bills, is certainly a lot better than having nothing.
Nothing. It's better than nothing.
But if you plan ahead, you don't have to worry about that.
That's what we're here for. I want you to plan ahead. I want you to talk to Bill, and I want you to plan ahead. Here's what you do. All right. There are a few different types of Medicare supplements, and I'm going to just do the two you taught me. You have a choice between the HMO, where you do exactly what you're told, when you're told, you haven't got a lot of choices. Better than nothing,
Right.
zero premium. Okay. Now, the other extreme to that is something called an F as in Frank plan.
It's Medicare and Supplement Plan F, and there is some understandable confusion that the government creates, what's new,
Yes.
because the Medicare elements are called parts A, B, C, and D, but the supplements are called plans A, B, C, D, E. and
Don't
F.
even go there.
So we're talking about Plan F supplement, which is the most popular plan. It is now the most expensive of the 10 plans. It didn't used to be. And it is the plan most people have, because with Plan F supplement and Medicare A and B, except for prescriptions, you should never owe a dime on any of your medical bills in or out of the hospital, period.
Even though I have to pay, I get basically everything I want when I want it, as long as it's not cosmetic surgery or cosmetic dental.
You don't need anyone's permission to see a specialist. The only two things required is that it's a covered expense under Medicare and that the doctor takes Medicare patients that you've seen. Then you shouldn't owe anything. That's a tremendous financial relief.
It is a fine. It's a relief, but it's going to cost you. It's going to cost you about $160.
Well, actually, right at this point in 2013, I have a Plan F for $138 a month, and another one for $148 a month. So that's about what you'd spend this year, 2013, for a Plan F supplement, and then you pay the $105 to Medicare for Part B, and the $137 for the supplement, and you're covered,
So
except for prescriptions.
Right. What's coming out of your pocket is, let's say, $140 a month, okay, for the premium Medicare supplement
Right.
plan. It's $140. Plus, you're going to pay an additional amount every month for a drug coverage.
And that
okay? And that can run what,
$18 to $118. It depends how extensive your drug list is, how many brand name drugs are on it. I can't tell anyone what the best plan would be without taking their drug list, which I plug into the Medicare website for you, and will tell you in a report what are the lowest total cost of the plans available, and we'll enroll you in the plan that suits you, that you like the best.
So we've simplified it. Basically, you need to plan ahead if you want any kind of freedom of choice when it comes to Medicare insurance after the age of 65.
Right.
You want any kind of choice, any kind of freedom, plan ahead and figure out a way to put enough money aside so that you have, I'm going to round it off, okay, Bill? I'm going to round it to $200 a month to cover every bit of your medical that you could possibly face.
And one thing I want to stress with that, you can go to any doctor that takes Medicare, not only in Riverside County or in the state of California, but in the entire United States, all over the country. You have coverage under this.
You have freedom, and you have coverage. But without this kind of Plan F as in Frank, it ain't going to happen, okay? You're restricted. So I did a little research, and if you plan ahead, starting at the age of 40, plus or minus, and you put $14,000, save up your money and put $14,000 into something like an annuity. You could buy a piece of real estate too. I mean, it doesn't matter, but this is an inexpensive way to get into it. Okay? Correct me if I'm wrong at any point in time here, Bill. You put $14,000 into an annuity, which is an investment thing with an insurance company. Wait 25 years, it'll go past really fast. And then you're 65 years old. That annuity will then begin to pay you $200 every single month, which will pay your premium on your really good Medicare supplement insurance with your drug policy, everything. You're good to go. Plan ahead. Okay? Next, you have not planned ahead, and you're 68 years old. Well, you got $40,000?
Yeah,
40 grand?
Not 14, 40.
No, 40, because you waited to plan ahead. You need $40,000 in an annuity or something like it to get the $200 a month to cover your health premium so that you're good to go. So you can either plan ahead at 40 years old, give or take, and put $14,000 into this instrument and get $200 a month at the age of 65, or you can, oops, I'm 65 or 68 years old, I don't have $200 a month. You better come up with 40 grand, put it into an annuity, there's your $200 a month.
And there's an in-between option, which I
Well-
can only guess at the number, but if you can't put $14,000 in right now at age 40, if you start at age 40 putting in $1,000 a year for over 20 years, you'd have only $20,000 put in, and you might still have close to that 40,000 in there.
Right, so there's a whole bunch of different ways. Call Bill. That takes care of it. Now,
And one thing I want to mention, I do have a brochure for people about to turn age 65 that explains in very basic terms all about Medicare, A, B, C, and D, in understandable terminology. It's put out by my Health Insurance Trade Association, and I'm happy to provide it to anyone that inquires for it.
yeah, well, that's why I have you, Bill. Yes, I can just call you anytime. Here's your phone number. Turning 65. If you don't like to read in all the details, call Bill. If you want to have something like this, call him and he'll send it to you. He'll bring it to you. Now, my next favorite subject. 2 things. Here's what you need to plan ahead. Something called long-term care insurance. But before you do anything, get something called a California Advanced Healthcare Directive. This is it, okay? This is it. See it right there. A California Advanced Healthcare Directive. Do not go beyond 20 years old without one of these. Please. You go online, you go to, just put in on your, just go to Google or something and put in California Advanced Healthcare Directive. That's all you need to do. It prints it out. It's got pictures, look, little stick pictures, people, part 1, part 2. Simplest thing in the world you can do. Sit down, fill it out, get it done. You'll never have to do it again. You have to have one of these, because if something happens and you can't speak for yourself, somebody else is going to take over, and if you're on life support, they pull the plug just because they feel like it. If you don't want the plug pulled, you have to have one of these. Okay, so now, long-term care insurance. Well, I'm 40 years old and I don't need long-term care insurance, Bill, because gee, we just talked about Medicare and the supplements and all that good stuff, and that'll take care of me.
No, it will not.
Okay,
And it probably seems even farther off than needing health care at age 65. And in truth, most claims begin from age 70 and up.
okay. That's when most people claim long-term care
But
insurance.
if you wait till then, you won't be able to afford to get it. You probably won't medically qualify to get
You're
it.
toast. Forget it.
Yep.
Don't even go there. The best time to buy long-term care insurance is
In your 40s.
40s. That's where it's the least expensive.
The second best is 50s up to 55. When you get to 60 and up, it
No. You want to go there. Just don't even go there. You can't afford it. Unless you're a millionaire like you've been. Okay.
semi-millionaire.
Semi-millionaire at that point. The one smart thing that I did when I was 45 years old, I bought a long-term care insurance policy. The reason I bought it is because I had just gone through 7 years of my mother having had a major stroke. I knew what it was to have to step in and care for her, diaper changes and all, even though I loved my mother. Trust me, changing an adult's diaper is not something you want to do. Don't think about it. Do whatever you can to plan ahead so you don't have to place yourself in that position or have someone you love place you in that position. please. So at 45 years old, I bought a long-term care insurance.
Back when they were even better values, you've got a great,
I got a great, you've read my policy.
yes, and it's a very good policy. You couldn't even replace it today.
You can't.
And at
okay?
a cost far less than it would cost today. But
what
if
I'm paying today in premium is $521 and just $500.21 and some change, okay? That's it. That's what I pay per year because I bought the policy to begin with when I was 45 years old. There isn't any place I can't go. In my home, it'll pay $100 a day. Pretty good deal. And in a really nice luxury assisted living facility, like the one that I've been looking at, which is Windsor Court, Luxury Assisted Living, Windsor Court, Palm Springs, California. Nice place. If I ever need it, if I ever need it, I got $200 a day to go in there. That's 200 times, that's $6,000 a month. I can get a beautiful suite for $4,000.
it's $72,000 a year now.
You betcha.
Without this policy, where is anyone going to come up with $72,000
Well,
a year?
I tell you right now, I wouldn't. So, long-term care insurance. I have a good policy because I was just lucky and semi-smart at the time. So I pay 20 years later, almost 25 years later, $500 and some change a year. However, if you're 40 today and you want to get a long-term care insurance, Bill ran the numbers. We're looking at 40, we're looking at $2,500 a year in a premium.
For a good policy.
A good policy. What if you wait until you're 55? But remember, if you get sick in between, forget it. You can't even get the policy.
You
right?
might get it at double the premium, then cannot be able to afford it, or simply be declined.
Yeah.
But otherwise, if you can qualify at age 55, the premium could be in the neighborhood of $3,300 a year.
And what if you wait until you're 60 and pray to God that you're still healthy?
Same benefits would be at probably over $4,000 a
year.
Regular health insurance, as most people know, goes up because you get older, and because there's a general rate increase. Long-term care insurance rates are always based on the age you were when you got the policy, plus a general rate increase. So if you buy it at age 40, you're going to be paying the rate of a 40-year-old when you're 75 at the rate table in effect then, but that greatly reduces how much the increases are going to be.
Well, what I did was my first year at 45 when I bought the policy, I paid $200 and some change, like $206 a year for my premium. I mean, really, come on. Now, 25 years later, or 20, whatever it is, 20, 25 years later, it's doubled.
But still, it's a bargain and a half.
It's a bargain. Whatever you do, call Bill and talk to him about long-term care insurance. How hard a sale is this? I mean, how difficult is it to get people to understand at 40 to think about this?
There's generally two types of people, and you already touched on the one type. If someone has had a long-term care experience in their family, they begin to know the burdens, the costs, and begin to realize that they should have it on themselves. But that's certainly not the majority of the population. And otherwise, at age 40, I'm guessing it's one of the farthest things from anyone's mind. But there are a lot of myths out there that make people think that they don't have to worry about it or don't need it. They will
Or somebody else will take care of me, like Medicare will take care of me, the government will take care of me.
My spouse will take care of me, kids, and that's, by the way, there's all kinds of great statistics showing that when there's a lot of family members providing caregiving, it costs the rest of the family an enormous amount of money and loss health status because it wears the health down to the caregivers. They lose work, they lose money. It's a terrible situation all the way around when you can avoid all of that by having long-term care insurance, which pays for custodial people to come in and take care of the person at home, or if necessary, go to assisted living, and if necessary, go to a nursing home, and have the family be freed up from that burden, and it's a much better outcome. A lot of times, couples have saved a great deal of money in their retirement funds, maybe $500,000, which may or may not be enough to retire comfortably financially, but when one of them gets sick and needs long-term care, they're going to spend their retirement money on that. And if that person eventually passes away, the survivor now has very little left in retirement funds, has lost their spouse, their life is not in a good position. So it's really part of financial planning to not only protect and build your retirement funds, but to even use some of your retirement funds to pay for the long-term care, because that's going to protect the rest of your retirement accounts. So make this a part of retirement planning.
Bill Robinson is a licensed independent life and health agent since 1983. He is a member of the National Association of Health Underwriters. He is a board member for 10 years. He's a legislative chair and communications chair. He's on the board of the Inland Empire National Association of Health Underwriters. He's a board of directors with the Desert Cities Association of Health Underwriters. He's been a treasurer, a legislative chair, and a communications chair. He's a lifetime member and a leading producers roundtable member. He has a very loyal, very large clientele, many of whom have remained with him for 20 plus years. He served 4 terms as Vice President of Legislation for the California Association of Health Underwriters. He's the state chapter of Health Underwriters. Sacramento and Washington, D.C. are places where Bill goes every year for the past 15 years to meet with elected legislators so that he can press for additional health care reforms to benefit his customers and to amend or defeat some really bad bills that can hurt your health care. The new federal health care law reform, the Affordable Health Care Act, or Obamacare, who knows what that's going to be. So what you really need to do is, with all the upcoming changes, you need to be able to be in touch with Bill Robinson on a regular basis so that you can keep up with all the changes, so you have the right information at the right time.
Palm Canyon Insurance Agency is located in a most wonderful building along Palm Canyon Drive, south of Vistachino. It looks like a 100-year-old Spanish hacienda with wrought iron lantern lamps, red tile roofs, a water fountain out front, and a beautiful interior courtyard with a Spanish water fountain. It's a very distinctive, comfortable building. It doesn't look like an office building, but it is.
Hi, I'm Ruby, Bill Robinson's client service representative here at Palm Canyon Insurance. I'm here to greet you when you come in and greet you over the phone.
Well, you could not go to someone who is any better at this than Bill Robinson. And I'm doing this show because I am adamant about the importance of both of these types of forward-thinking insurance. And by the way, Bill Robinson is highly, highly qualified.